So you've been invited to this meeting because we have concerns that you might have sleep apnea. Some of you may already know you have sleep apnea and maybe have been treated before, maybe not. I guess the first question that might come to mind is, why in the world do we even care? This is supposed to be a weight management program. Well, let me tell you, there's a lot of reasons why we care. In essence, when you come to this clinic, it isn't some sort of weight loss center where we just have you dive in and do a diet, and then when you lose weight, it's all yahoo, you've lost weight, because we're more interested in helping you not just lose weight, but discover the reasons for weight gain in the first place, or the barriers that are going to keep you from having long-term success with your weight and with your overall health and happiness, your energy, your vitality. And so we start looking very early on for things that might have contributed to weight gain, or that might be causing the weight to become a much more serious issue for you, or that might stand in your way of success. Sleep apnea ends up near the top of the list for many people. So you ask, well, why? Well, there's a number of reasons why. You might be able to answer the questions right now yourself. What do you think sleep apnea does? Well, first of all, what is sleep apnea? It's a condition where during the night, while you're deeply asleep, you generally are snoring. Not always. It's not always something that sounds like much, but in essence, your airway starts to close off. And as it does, usually there's a snoring sound or whatever, but then eventually the airway that's sort of flapping like this shuts off completely. The tongue kind of falls to the back, the palate comes up against the tongue, and you lie there until such time as your body recognizes an emergency is occurring. An emergency in the sense that your blood oxygen begins to go down. How far down does it go? Depends how serious your sleep apnea is and how long your body has been getting used to this, essentially. In some of you, when we assess you for sleep apnea, we're going to see some very low drops in blood oxygen happening very frequently, perhaps dozens or even hundreds of times a night. So what would that do to you? What happens when you have your blood oxygen go down very low and you end up in this state where you're not breathing? Well, the main thing that happens is that you get pulled out of or aroused from a deep sleep. And as you probably know, sleep is not a simple thing. It isn't that you just somehow fall asleep and magically wake up in the morning and you feel well again. It's a pretty complex thing. As we study sleep, we realize that the actual process of sleep involves the brain going into different stages of quietness, you might say, where when you're in a wakeful state, your brain is active and alert, and if you put a machine on the head called an electroencephalograph, you'll see brain waves. Those are waves of electricity generated from the brain that are very rapid. They're like bzzz, like this. Sort of like the buzz coming from a electrical device that's like bzzz, it's fast. As you start getting drowsy, the brain waves start to slow down. Bzzz. As you get into the early stages of sleep, the brain waves get even slower. Bzzz. Pretty soon you're in a state of real sleep where your sleep is getting deeper and the brain waves are boo, like this, until you're in the deepest stage of sleep where brain waves are just whoa. You're now truly unconscious. You're almost in a state that would be similar to being under anesthesia or being in a coma. This is the part of sleep we simply call deep sleep, and it's the deepest part of the sleep cycle. Near the end of this deep sleep, you begin to go into a state we call REM. It's called REM because you can see it. Rapid eye movement, REM, is where that comes from. When you're having REM sleep, you'll see the person and under their eyelids, you'll see their eyes darting about, looking this way and that way. Why? We don't know exactly. Maybe it's somehow kind of exercising and tuning the eyes up, or maybe it's part of the fact that the visual cortex of the brain is working. That's why dreams usually have some visual element to them, where you're seeing things and your eyes are moving about as though you're actually looking at things. And then, of course, sometimes you're actually acting things out. If you have a dog, you probably get amused quite often when your dog is dreaming and the dog is and maybe running after a bunny rabbit or something like that. It's obvious the dog is having a dream. And humans go through REM sleep and dream as well, of course. And that usually ends up being the end of the sleep cycle. And you come into a light sleep again. Maybe you wake up for a brief period of time. That's often when you wake up, have to go to the bathroom and get back to bed and so on. So that's called the normal sleep cycle. It usually happens about every 90 minutes throughout the night. The problem is that when you're in the very deepest part of sleep, your muscles become extremely relaxed, including the breathing muscles. The muscles that help you breathe are the chest muscles, or what we call intercostal muscles. If you are not a vegetarian and you've ever eaten ribs, you're eating intercostal muscles when you eat ribs. Those intercostal muscles are quite voluntary, and as you get into deep sleep, they more or less become very quiet and still. Most of the breathing is occurring only with the diaphragm. And you can imagine if you're a heavier person, and when you're standing upright and your belly is sticking out a bit, perhaps, if you were an opera singer, you might be very good at it. You might be able to, la, like Pavarotti, la. You know, when Pavarotti was standing upright, his diaphragm moved down very nicely because of the nice weight he had down here pulling down. But you can imagine when he went to bed how different that would be as his belly was pushing up against the diaphragm. And in deep sleep, a person with more contents in the abdomen, once the rib muscles, the intercostals are still during deep sleep, the diaphragm is doing all the work, and now the diaphragm can't move much at all. And then when you gain weight around here. So you start to crowd out the structures that have to remain actively open to maintain an airway. As you're getting into deeper sleep and the jaw starts to relax and falls back, pretty soon, if there's too much extra material, fat that's incorporated itself around the larynx, you know, the voice box and these muscles in here, and particularly if you have a larger tongue or a larger palate or a shorter jaw, these are the kind of things that add up to create a higher risk of sleep apnea. And so when sleep apnea occurs, it occurs generally in the deepest part of sleep or during REM sleep, and it's something that your body will eventually sense that you're going to asphyxiate if something isn't done. So what occurs is what we call an arousal. This is a situation where hormones like adrenaline are released. Everybody knows adrenaline probably quite well. It's the hormone that's released just before you have to stand up at someone's wedding and give a speech, and your hands get kind of sweaty and your muscles get tense and you feel kind of fidgety and your heart might start racing a little bit. That's adrenaline. It's the hormone of the fight or flight response. Now, the last thing you need to be doing when you're into deep sleep is having a fight or flight response. So unfortunately, when you have this surge of adrenaline, it tends to be the thing that finally gets you to breathe again. And some of you, your spouse or partner may have witnessed an arousal by the fact that maybe they were listening. Is he going to breathe again? Is he going to breathe again? And then all of a sudden, like this, that's an arousal. But it may not be quite as dramatic, and yet you're being pulled out of a deep sleep. That's essentially the big thing here, is that when you're finally in that state of sleep where you're going to really get rest, you're going to end up being pulled out of that restful state before you get rested. And that happens potentially over and over again, because as the night progresses, you get increasingly exhausted, and your body more and more craves that deep sleep. But then as it gets you into that deep sleep and you have apnea, you have an arousal and you not necessarily awaken, but you come out of deep sleep into a light sleep. And many of you actually are awakening and finding it hard eventually to get back to bed, because once you get enough adrenaline in your blood, you're lying back in bed trying to sleep. You might have gotten up to the bathroom several times by then, or maybe just awakened and start thinking about lots of things. When there's adrenaline in your body, you tend to feel kind of, wired, you might say. You might start feeling tension. You might have a lot of thoughts racing around in your mind. It might make it very hard to get back to good sleep again. And In some cases, you're so exhausted because this has been going on so long, you never really wake up at all. You don't really realize that you're having these arousals, but your body knows because it never gets fully rested. So you're here because we believe that you are at risk of sleep apnea. It may be because of your weight or your BMI. Every point above a BMI of 30, which is the point where we now say that's obesity, puts you at risk of sleep apnea. Once your BMI is over 40, it's not guaranteed that you have sleep apnea, but it's very likely. Most people do, to some extent. You may have scored high on one of the questionnaires that we administer. For instance, there's a questionnaire called the Epworth questionnaire. It's a sleepiness scale, and it asks questions about how easy you fall asleep in the daytime and things like that. So if you told us that your sleep is not very restful, or you wake up in the morning with a headache, or that you feel tired in the daytime, you could easily fall asleep and have a nap, or you feel exhausted a lot of the time, these are things that suggest sleep apnea. Now, why is it important for someone who is trying to get better health and improve their weight? Well, first of all, when you're exhausted, most of the time it's very hard to get motivated to do much. It's hard to get out and exercise. It's hard to feel enthusiastic about change. It's hard to get all excited about learning how to menu plan and prepare meals and things like that. And in fact, it starts to affect your brain more deeply than that. When you have this persistent or recurring drop in oxygen throughout the night, what happens is that it puts a great deal of strain on your brain. And we know there's very good evidence now that a lot of individuals that are struggling with depression for long periods of time, where that depression does not relieve fully with medication or treatments of other sorts, that some of those people have this persistent depression because of sleep apnea, because of the stress that it puts on your brain. And over the long term, we have evidence now that long-term untreated sleep apnea leads to a much higher risk of dementia. So we have exhaustion, depression, dementia. These are things that are certainly going to contribute to more difficulty getting back to good health again. On top of that, when you have sleep apnea, it causes a rise in inflammation in your body. We can measure inflammation with measurements such as the C-reactive protein, which all of you probably had done with your initial blood tests. And many of you, the C-reactive protein was elevated, and it might be partly because of your weight, and it may be even worse because of sleep apnea. If you have inflammation in your body, of course, you're going to feel more tired, you're going to be more stiff, likely to have aches and pains, and maybe things like chronic headaches and so on. So, of course, that's going to have an effect on your ability to participate in healthy change. Now, probably the biggest thing of all when you have sleep apnea is that it causes a rise in the hormones that more or less dictate your eating behaviors. You think that you make food choices by free will. Now, that's true to some extent, and we want to change that. We want to help your ability to make better choices. We want to make that ability much stronger, but there are also hormones that circulate through the brain that are very powerful in determining the kinds of foods that you eat, how much of those foods you eat, how quickly you eat, when you feel hungry again, when you feel satisfied, when you feel like you want a snack, and so on. And when you have sleep apnea, it's very clear that those hormones that drive increased eating behaviors, they go way up. So again, if you're trying to get your weight under control and you're fighting against the hormones flowing through your brain, who do you think is going to win? You may win for a while with willpower, but if you don't get your brain on your side, it's going to be tough. So in essence, there's a lot of reasons why dealing with sleep apnea can make a big difference. If you get sleep apnea treated, generally within a reasonable amount of time, you start to sleep better. Your sleep cycles are finally occurring. You're getting that deep sleep again, that restful sleep. Inflammation starts to come down in your body. Appetite hormones start coming down. Energy levels start to rise. You start having more mental clarity and improvement in your mood. Those sorts of things are often expected. Now, it doesn't happen necessarily overnight if you've had sleep apnea for a long time and it's been severe, because in a sense it's almost like a minor brain injury when you're having sleep apnea, and if it's treated, it isn't that the brain is suddenly better again. It'll take some time. So those are the reasons why we're concerned in terms of your weight management. There's other things that concern us as well. Let's talk about your heart. It's probably pretty easy to imagine that next to the brain, the organ that needs oxygen the most is the heart. It's true. So when you have these periods of deep, what we call hypoxia, or lower than normal oxygen levels, the heart is exposed to substantial risk. In essence, when you have apnea, you can say that if there's already some pre-existing problem, say with the circulation through the heart, with your coronary arteries, that might be the time that you end up with a heart attack. Some people end up dying in their sleep, and probably many of those cases are during a period of sleep apnea. Not to scare anybody, but the fact is that sleep apnea is a risk factor for cardiovascular events. It's also a risk factor for developing significant arrhythmias of the heart. These are irregular heartbeats that can be sometimes very harmful. The most common arrhythmia that's associated with sleep apnea is called atrial fibrillation. It's an arrhythmia that's very common. It's one that leads to a very high risk of stroke, because when you have atrial fibrillation, you can form clots in your heart that can then float up to the brain. So you have to be generally on a blood thinner or anticoagulant. So it's a serious matter. And we've often seen people with atrial fibrillation where no one has ever evaluated them for sleep apnea. And in my mind, if you have atrial fibrillation and you're a heavier person, it's mandatory that you're evaluated for sleep apnea. And if you have it, it must be treated. So sleep apnea is a contributor to weight gain and a barrier to weight management. It's a significant risk factor to mental health and mood, to cognitive abilities over time, like the risk of dementia. And it's also a significant contributor to pain and to stiffness because of the inflammation and exhaustion. It really diminishes the quality of life, and then it is a big cardiovascular risk factor. So we consider sleep apnea a top priority here. It's something that is dealt with as early on as possible because it is so significant and it can make such a difference to treat it. So the question is, so how do you know if you have it? Well, today you're going to go home with equipment that you'll learn how to put on the devices that are there to assess whether you have periods of hypoxia, where your blood oxygen goes down low, whether you stop breathing, whether you snore. The equipment you're taking home is called a level 3 sleep study. That's what it will perform. It's better than a simple overnight oximetry test. Some of you might have had this test where you just went home with a thing on the finger. That's sometimes good enough to pick up sleep apnea, but generally you need more data. You need to know whether it's whether you're snoring, whether your breathing is labored, if your airflow through your nose is impaired. Those sorts of things we can tell with a level 3 sleep study. So the level 3 sleep study you'll do at home in the comfort of your own bed. You should sleep the way you normally sleep. Don't sleep on your back just because maybe somebody told you to. We're not telling you to do that. Sleep the way you normally sleep. We want to see whether you're having sleep apnea under as normal circumstances as possible, okay? You might wonder, well, I don't sleep well, I'm tired all the time, my doctor put me on a sleeping pill. What about that? Well, just so you know, anything that increases sedation or makes you even sleepier is likely to make sleep apnea worse if you have it. So although you may have problems with sleeping because of sleep apnea, if your doctor gave you a sleeping pill, you're going to sleep more, but your sleep quality could even be worse, and your sleep apnea could even become more serious. So keep that in mind with things like sleeping pills. For sure with alcohol, some people don't even have sleep apnea unless they've had a bit too much to drink or unless they've taken a sleeping pill. So beware that there are things that can make sleep apnea worse. Some of you might say, well, what if I just lose weight? Well, If you lose weight, sleep apnea usually starts to get better. Does it ever go away? It depends how serious it was in the first place. And that's where, when you come back, we will have the results of your level 3 sleep study. We'll review the results one by one, and we'll show you how we make the decision as to whether you need to be treated or not. And if you need to be treated, what should that treatment be? So that brings up the question, what is the treatment of sleep apnea? Well, there's a few things that have been done, and some of which I think are probably not that effective. There's a variety of surgeries are still occasionally done to, say, lift the palate, or to even shorten the base or make the base of the tongue smaller. That's probably appropriate under some very unusual circumstances, but as a general rule, they're not effective enough to treat more serious sleep apnea. There are also devices that the dentists can make and provide that are called mandibular advancement devices, and they're devices that hold the jaw forward. And that, to some extent, helps prevent the tongue from falling back in the back of the throat. And it may help milder cases of sleep apnea or just simply reduce the symptoms of snoring. But we have very little evidence that those devices are good enough for more serious sleep apnea. So we don't often refer anyone for a mandibular advancement device, but sometimes there's no other alternative that works for that person. In reality, the only real treatment that works for sleep apnea, for any significant form of sleep apnea, is a treatment called CPAP. Now, CPAP stands for Continuous Positive Airway Pressure. So what it means is it's a device that sits by your bed, there's a hose, and then it's attached to your airway, either your nose or like on your nose, around your nose, or around your nose and mouth, or sometimes even over the whole face, which creates airflow into the body, and that keeps the airway inflated. You can imagine this, that when you breathe in, there's kind of a vacuum that occurs. You breathe in and that's why the airway sort of flaps like that, because there's a suction occurring when you're breathing in, and that suction is what wants to slap the airway shut. When there's CPAP, air is flowing constantly into the airway, and it inflates the airway with a slight pressure so that you can breathe in like that without, like this. And when you breathe out, you're breathing out against a bit of pressure, but it's usually something your body kind of gets used to, and so you are able to breathe in and out. Some of the newer CPAP machines actually have two pressures. There's a pressure for inspiration, which helps to keep the airway open. And then the pressure, as soon as the machine senses your lungs are full, the pressure drops so that you can easily breathe out without breathing out against so much pressure. A lot of people will look at the idea of CPAP and go, ugh, forget it, not for me. Or maybe they tried it and just like, ah. It's certainly not the thing that you would choose if you had a choice, but you have to keep it in perspective. This is something that might reduce the risks to your health in a very dramatic way, that might give you a real improvement in your quality of life, and may give you a catalyst towards getting your weight under control. So it's something you've got to think of this as a very serious matter, and it's worth doing what it takes to get used to CPAP if you need it. And there'll be some of you out there that really need it. Absolutely. There's some of you where we're not sure, but it might be worth a trial of CPAP to see if it helps you feel better, gives you more energy and so on, relieves the drops in oxygen. And there's others where we'll do the test and we'll say, you know what, you don't need to worry about this at this point. Maybe we'll recheck it in a few months when you've lost some weight. But many of you will be told that you need to try CPAP. If you do, it's important that you give it a good, honest try. First of all, we have a respiratory therapist that will work carefully with you to find the right device that fits gently over the nose or around the nose or over the mouth, whatever sort of fits your anatomy and your circumstances. And it often takes time to get the right device. Some of them feel like nothing. They just are there and you hardly even notice them. Oftentimes there's some simple things you can do that can make a difference in terms of, like for instance, people say, well, the mask comes off in the middle of the night. Well, it might be that the hose is sort of just dangling around your head, and if you simply had something to keep the hose up out of the way, like a Velcro strap that you can hook up to your bed, headboard or something like that. Some simple things like that can make it work for you. So the big thing is to give it an honest try, and if you're having problems, to talk to the respiratory therapist. They may need to adjust the pressures on the machine. They may need to try a different mask or nasal device. They may need to try a machine with two pressures, an inspiratory pressure and expiratory pressure. There's a variety of things that can be done so that you can finally get to sleep with this thing on and sleep through the night. And I can tell you, if you have significant sleep apnea and you sleep through the night with your CPAP so that you wake up in the morning refreshed, you're going to fall in love with that machine and you're going to never want to let it go. I mean, we hope that you can one day let it go. If you lose enough weight, we're going to retest you and see if you still need it, months or a year down the road or whatever. If you've lost a substantial amount of weight, it's worth seeing if you still have sleep apnea. But it may be the thing that you need to get treated before you can actually do the weight loss in the first place. Now, just as an extra precaution, if any of you are considering going for bariatric surgery, they will not accept you for surgery if you have sleep apnea and it's not treated. Simple as that. So we just simply cannot refer you. It's too much of a risk factor. What we know is that heavier individuals have a high risk of complications and even mortality around surgery when there's general anesthetic involved. The main reason is because of apnea. You either have apnea in the recovery room that causes an arrhythmia, or you go home on painkillers with apnea that's untreated, and now with painkillers your apnea is really severe and you may die at home. So they will not take the risk on you if you have sleep apnea and you're not treated, just so you know. So one way or another, we'll help you come to a conclusion as to whether you really have sleep apnea, how is that really affecting you, and is it something that is serious enough that you should at least do a trial of CPAP to see if you can bring this under control and have a chance to see what a normal sleep is really like. Because some of you have gone for years without a single night of normal sleep. And you really deserve a chance to see what it's like to feel what sleep should do for you. So hopefully this gives you a bit of a sense of why this is important and why we brought you here today. And now I hand things over for you to know how your sleep study is going to go.